Hello, everybody. So today we are in our new podcast, Formatk podcast, and today we are with Dr. Nadav Pam. Our podcast, if you don't know, it's about all the technologies and the innovation and latest trend on aesthetic treatment. So today we are with Dr. Nadav, and he will talk with us about Titan Right. That is the latest trend that conquered the world. And we want to know what is Titan Bright and what is so unique. So first, welcome to that.
Thank you, Karin, for having me here. So today we're going to speak about the revolutionary Titan Bright IPL protocol intense pulse light, which is a non-invasive treatment that doesn't need any injections, needles, or any topical chemical pills or oral drugs to achieve correct tone of the skin, correct brightness of the skin. It also addresses the wrinkles and pigmentation and superficial vascularities that can be on the face, and all in one.
All in one treatment, so you can correct and improve the skin?
Yes, and the way we do it is by 3 phases. But before we go into details, our clients are mostly females from the age of 40 and above. The older we get, the more damage that our skin presents. We know that all the sun damage that we collect from from the childhood, our skin has memory, and it will manifest more and with more emphasis the older we get. So if we are 60, 70, our skin becomes more lax, more wrinkles, we have visible pigmentation, and people usually want to have one safe treatment that can address all the different aspects of their face to create an even results all around. And our Titan Bright is able to do so.
So explain to me more. What is Titan Bright? Like a combination of a multi-treatment, or it's only the IPL treatment?
So our treatment is based on IPL technology, which is flashes of visible light. It transmits heat, photons into the skin. And the way we do it is that we accumulate heat in a certain way by moving the applicator back and forth, generating heat in the skin. We take this information from the radio frequency world, where we know that if we reach to around 40 degrees about skin surface, then something happens like a miracle in the dermis. A new collagen is being formed, it's being reorganized, we have elastogenesis, neocollagenesis. All of these effects come from inside of the skins to correct itself without additional injections or topical creams or oral drugs. And in this way, we get a safe approach to all of those aspects that the people demand today, because our face is like a mirror to ourselves, and the society judges us, and we also want to look in appearance to be younger. The IPL technology exists from the 1990s, and it has hundreds of thousands of treatments around the world. And it's considered overall one of the best technologies to achieve that aim. We don't have any consumables, and it's quite an easy, safe procedure for a skin expert.
As a woman, I have so many questions about this treatment, because first of all, if I want to do like something that give me an even skin tone, like usual go-to will be to gel, cream, or even peeling, clinical peeling. I know that they have such a thing. And what is different between those typical treatment to the IPL, and in terms of side effect or interval or times that it's going to take me to see results?
Thank you for the question. Let's break it down into topics. In chemical peels, you basically shave layers of your skin. If it's superficial peeling, epidermis. If it's more strong peeling, then dermis. And if it's the strongest peeling deep, then it's even deeper layers. And therefore, you are not correcting the existing skin, you are just removing the damaged skin. Here, we don't have anything that is invasive. We put the gel, we put the IPL, and through the heat that is generating from the IPL applicator, the body will correct itself according to the clinical theory that we know of, generating neocollagenesis from the inside. We're basically doing induced damage that the body knows how to correct itself by using the IPL heat. So if we want to compare to drugs, Here we don't put anything through our body. We don't need to take anything before the treatment or after the treatment from the mouth, so we don't affect the rest of the cells in our body that is not related to the skin. So we have a treatment that is targeting the areas where we have the problems on the skin with minimal downtime, and the patient can go back to his daily routine, to work, and we do the treatment once a month, and you can start seeing the results from after the first treatment.
And it's like right ahead, like I would see the result after the first treatment, or it take a couple of hours or even weeks?
According to the theory of neocollagenesis, it takes about up to 1 month between each treatment, so it's gradual effect. It's not immediately to see the whole benefits, but you start seeing the beginning of the effect after the first treatment. But neocollagenesis takes 1 month time interval between treatments. We usually say that you need about 4 treatments, but this is also based on how severe the skin damage was for each individual patient to know how he or she will progress. Anytime you are using IPL, you need to be certified that you know how to diagnose the skin correctly, that you know that you're not treating any melanoma or skin cancer. You need to adjust the parameters according to the skin type. You need to use safety goggles. You need to use Parker gel, and you need to understand the system that you are working with in order to create the correct parameters. Usually what happens is that if you don't know the exact step and you are not trained, then you can have side effects. But we have melanin meter that adjusts the correct, helps you to choose the correct skin tone, Fitzpatrick type of the skin, so we can adjust the parameters with the machine, and the gel, and the safety glasses, and a skin therapist that knows how to work with our device and has training to therefore minimize the potential for any side effects, so it's considered safe and effective.
Okay, so I don't have any side effect, but the treatment will hurt, like will be painful?
So we should inform the patient that immediately after the treatment he might have some swelling and redness on the face that will subside within a few hours. Pigmentation is known that it starts from the dermis, and the pigment will resurface to the epidermis and then become scales. This can happen over a few days or up to 2 weeks. The patient should be informed not to scratch it off, and it's part of the normal healing process. During the treatment, when the skin will elevate in temperature, you might experience a bit of warmth and minimal pain. But this will subside immediately when the skin is going to cool down itself. So there is always a game between the cooling system, cooling of the skin itself, and applying the correct amount of energy by heat diffusion there. So there is always a balance in between. But this is completely tolerable, and the patient can go back to his daily routine at the end of the treatment.
But I want to talk about the benefit for the clinic and for the beauticianist, what they will gain from such a treatment.
First of all, you don't have any consumables, so you don't have to roll on the cost of consumables to the patient. It's a non-invasive treatment, so you are not going to cause infection, just like needles can do. You don't need to inject anything to the skin, and you don't need an additional topicals or peeling with this treatment. So it's standalone IPL treatment. That means you bought the applicator, you have X amount of flashes to use, and you can have a lot more patients and a return on revenue.
So, just for understanding, facial treatment will take like 1 hour, 1.5 hours. This treatment will take?
It depends on the size of the face, areas that you can choose to treat. For example, face, décolleté, back of the hands. So if you want all 3 of them, it depends on the areas that you treat, then the treatment will take a bit longer. But normally it's less than half an hour for the whole 3 region together. If it's just the face, it can be between 10 to 20 minutes treatment time. If they are all lined up and signed informed consent and they don't have any contraindication, then yes, then you can do a lot of patients within a given time frame.
And can you explain about the treatment, how it works, like step by step?
So it divides into 3 stages. The first stage is called phase 1. It has lower energy setting. It's just we do 10% overlap on the face, shoot 1 pulse at a time, and then we basically excite a bit the pigmentation in the skin. We are preparing the skin for the second stage. The second stage has lower energies but higher frequency, and we are moving the applicator up and down in a certain area, therefore accumulating heat, so that the skin surface temperature will reach to around 40, and there on quote the magic happens when you have neocollagenesis and dermal remodeling. And therefore we are repeating this process everywhere we want to treat: forehead, cheeks, lower jaw, neck, décolleté or back of the hands. And there is a third phase. If you have resistant pigmentation on that area, we take the stencil. We put the stencil, it's a plastic that protects the area, and we shoot another extra pulse on a higher jowls, just locally, to break down the pigmentation. In this way, we address wrinkles, telangiectasias, vasculature, toning, wrinkles, and overall brightening and tightening of the face.
What about pigmentation that you see under the skin? Like, I know that a lot of people have pigmentation, but you don't see it.
So the skin remembers everything from the childhood, but the longer that we live, then it becomes more apparent on the skin. So superficial pigmentation, we can see it even at this given moment, but we still have pigmentation that is non-visible in the naked eye. With several devices, with special filters, you can emulate and see it already in the face. But in this way, you can address even skin tone even before it actually manifests in daylight, but it's still there. So with this, you are actually also addressing the deeper layer of pigmentation. IPL can send its energy through the skin about up to 4 to 5 millimeters inside.
I know that in these days, everybody wants treatment that it's individual to their skin and their needs and their lifestyle. So are this treatment can be adjusted to the patients?
So we can adjust the parameters of the device and the energy according to the skin type and the area where we are treating. And therefore, our aim is to send the energy through the IPL and making sure that the skin has enough thermal relaxation time, so we are not doing overshooting with the energy, and to avoid burns and potential side effects. Yes, we are adjusting to each skin type, and according to the tanning of that skin type at this very moment, we adjust the frequency so we can do this treatment on all skin types in a safe and effective way.
Skin types, what do you mean? Like if I have like very light skin or even very dark?
We know that officially there are 6 types of skin types, 1 till 6. So 1 is the palest and the 6 is the darkest. And the darker you are in the skin, that means you have more melanin. That's the chromophore or endogenous substance that is the target of the IPL. So the darker you are, you need lower fluence and higher methods of deliverance. And we also need to know that we are not going to accumulate too much energy for the cells and therefore avoid any potential side effects. So the art is to correct diagnose the patient, to know exactly on which frequency to work. And we also have the cooling system in the applicator itself that we can control, and therefore we maximize results by avoiding potential side effects.
And what about regulation? Do you have all the equipment?
So each device and each system should have several regulatory improvements. The more you have, that means you are more tested. FDA is for the American market, CE is for the European market, but sometimes other countries that are not in the EU and not in the United States will require one of the two, if not both, just to apply to their country. And today Forma-TK sells its devices over 40 countries, so we had to go through this process more than 40 times. Different health administrators have their own approach to technologies, and they are allowed, according to their country, to ask or to be more severe in the restrictions. And we will adjust with our device and to meet their criteria, because the device needs to work under the regulatories of each individual country.
So thank you very much, Dr. Nadav Pam. It was very enlightening. And for our viewers, thank you for watching, and see you in our next podcast that we will talk about
whatever you will choose.
I think we will talk about pigmentation in our next podcast. So stay tuned.